Howdy friends, I'm your City Manager Seth Sumner with your daily COVID-19 update. It's Tuesday, April 14th, and I'll open with the Tennessee Department of Health numbers that were just updated a few minutes ago. We do have now a total number of cases COVID positive in Tennessee of 5,823. I have some not so good news to share with you with the number of deaths. They did increase by 15 between yesterday and today. That is a 14% increase. There was 109 deaths yesterday. There are 124 deaths today. That is the largest single daily increase since we've started tracking this, since the Tennessee Department of Health has started tracking this several weeks ago. And so we are, I think, fair to say, entering the surge, and we did see that double-digit increase overnight. So we are now at 124 deaths across the state of Tennessee. Good news to follow that is we are now at 34% of cases are fully recovered. There's 1,969 fully recovered COVID positive persons, and that leaves 3,854 Tennesseans who have not yet recovered, but we do wish them the best and hope that they do fully recover from COVID-19. Wanted to share also, of course, the total number of tests. You have seen this number continue to skyrocket as tests become more and more available. Just got off the phone with our regional health department officers a few moments ago, and they reiterated something that I hope you all are familiar with, that there's not been a case of any of our 10 counties in the region, of any of our health departments running out of tests. There have been enough tests to make it for anybody that has needed or now wanting testing. And I'll talk a little bit later about some opportunities for everybody out there that wants to get tested. There are some opportunities for you to do that here in McMinn County and here in Athens this weekend. There will be an opportunity. But there are now 78,831 total tests that have been conducted across the state of Tennessee. That number continues to skyrocket, and that is good because that helps us identify positive and negatives, hopefully more and more negatives coming through that. But it is disheartening and sad to see the number of deaths increase as dramatic as they did today. And so we just want to make sure that this is a good time to remind you, do your part, stay apart. Make sure that we're continuing to social distance, that we're limiting our trips, only making those essential trips to work if you're still at work, to the grocery store to get groceries. Just you, don't take the whole family if you can help that. And so we're limiting what those trips are. And hopefully ordering lots of takeout and dine-in from our local restaurants, and going online and using our local businesses for gifts. So I do have I was about to leave one thing that's probably most important to you is what's McMinn County's number today. And we are still at 5. We went to 5 COVID positive persons yesterday, and we are remaining at 5 today. And so that is certainly good news. So that leads me to my guest today is Miss Paige Zabo with the United Way of McMinn and Meigs counties, and you are the president and CEO now. Yes. Congratulations on that appointment.
Thank you.
And we're so fortunate. I know my employees here at the city, we do a lot to help out with United Way, as does many of our companies and workplaces across McMinn County and Meigs counties. Do a lot of fundraising internally. A lot of folks sign up to have money taken directly from our checks and sent directly to United Way because we believe so much in what you do, helping our neighbors in need. So for the folks that maybe not as familiar with United Way, do you care to share about what your mission and what is United Way? What do you do?
Well, thank you, Seth, for having me today. And I want to thank the City of Athens also for your great support. You all do a great campaign every year, and you also come out and do our Day of Caring. You bring a lot of volunteers, and we really appreciate that. That's y'all painted a lot of stripes, I think, on the parking lot. So, and we really appreciate that, and so do our partner agencies. The United Way's mission is to unite our community's resources to give everyone the opportunity for a good quality of life through education, stability in the home, and health. Those are the three areas that we focus on. And we do that by identifying the most pressing needs in our community. When we identify those needs, we communicate that out to our community and engage in their help in meeting those needs. And then we conduct our fundraising campaign every year. And we allocate funds to the partner agencies who apply for funds. They go through a very strict process to get those funds, and then it's community volunteers who sit on the panel and score these agencies and decide how those funds are allocated.
Wonderful. And so these are funds that McMinn Countyans and Meigs Countyans that they're contributing to this organization, and these funds go right back into our.
They stay local. They go right back into our own community.
Good. Happy to hear that. And last year, I know this is an astronomical number for us to think about. But how much was the total raised last year?
Last year we raised a little over $722,000,
wow,
which was over our goal of $720,000.
Beat your goal.
Yes.
Wonderful.
Yes. We have a great group of volunteers, campaign chairman and President's Council chairman, and a great volunteer board that work really hard and do a great job.
So. Our money through this organization stays here to help our neighbors in need, and I know that's important to a lot of people.
Yes.
Because we do have a lot of need here in our own
We have
community.
a lot of need, and especially right now with any crisis though, but we're seeing a large increase in need.
So let's talk a little bit more about this. During the COVID-19 pandemic, right now we're in the surge portion of this. We're continuing to see some numbers. They were looking really good yesterday when we did a little bit of a data dive with folks. Today we're seeing a little bit of a different story, especially with the deaths, which is certainly not what we want to see. So what is United Way doing now during the pandemic?
Well, what we are doing is we are gathering resources from our agencies, other nonprofit organizations, and government entities, and putting those resources together, and we have made a resource page on our website, and you can go to that at uwmcminn-meigs.com, and there's a COVID-19 tab at the top, and you click on that, and it's divided up into food resources, financial assistance resources, medical resources, and then we have a list at the bottom with just other resources, and those are good links to 211. We are a member of the 211 out of Chattanooga, and that covers 7 counties, and so they also have our organizations here, their information. So if they can't get in touch, with our office or with a partner agency, they can just call 211, and a professional will assist them there.
Okay. Wonderful.
Yeah.
What are you seeing right now as the greatest needs?
The greatest need we're seeing is with food and rent and utility assistance and just basic necessities. I brought some, just in 3 weeks, coordinated charities. They've helped 390 families, and they distributed 5,861 pounds of food. He's doing that through a drive-through service, Monday through Friday, 9:30 in the morning to 1:30. and then he's doing his financial assistance through the telephone to call, leave a message, and he's returning those calls in the afternoons and helping with that. Grace and Mercy Ministries, they're serving about 110 meals a day on Mondays and Fridays, and they're also seeing just new people they haven't seen before come there for meals. Those are carry-out meals. See, all these agencies have been innovative, and they've had to find new ways to provide their services because they're having to close their, the Coordinated Charities close their thrift shops, so it's a drive-through service. Grace and Mercy is carry out. The YMCA, they're feeding 800 to 900 kids a week. They're doing that at the Y through a drive-through, but they're also taking their vans out into some of the neighborhoods and out to the rural community also. And then the senior centers, they're caring for their seniors. They're still doing the Meals on Wheels to the homebound seniors. They're also offering a drive-through at the McMinn Senior Center to come and just get food and basic supplies. And they're doing that at the Etowah Senior Center as well.
Good.
Yeah, so, there's a lot. They're calling the seniors and checking on them, just making sure they have their medicines and just basic supplies.
And that's something that we've discussed on the daily updates just about every day, is making sure that we are reaching out, we're taking care of those vulnerable populations and the elderly. I showed some of the data yesterday, and then again with my staff this morning. We're looking at talking about the morbid side of COVID-19, and when you get to the elderly populations, you're seeing a third of the COVID-positive persons pass away.
Right.
And so it's so important to be able to be socially distant, but to check on those people, call them to make sure that they're getting the food and basic supplies and medicine that they need. And I appreciate everybody out there doing that, checking on their neighbors.
They are working very hard, and they are delivering meals to seniors too, if other than Meals on Wheels, if they need something.
Wonderful.
So that they don't have to get out of their homes.
Yeah. Mm-hmm. So you brought up a minute ago talking about partner agencies. You talked a little bit about, let's go a little bit deeper in how the models, the service models, have changed for United Way, for Coordinated Charities, for all of these wonderful agencies in our community, and how they're delivering their services.
Our office is, there's only 2 in our office, so we are at the office. We're closed to the public, to keep us safe and healthy. But you can call our number. We're there to answer the phones, and we can direct you to where you need to go, or you can visit our resource page, and that gives the address of all the partner agencies, and also any nonprofit organization that's helping make these immediate needs. They're also listed on that page, but they're having to do a drive-through. The pantries are all drive-through pantries. Or you have to call ahead to make an appointment for some services. The Full Circle, I forgot to mention, they are doing a diaper drive-through. They're giving away free diapers and wipes. They're doing the second one on Monday, the 20th. The Y is having to do their food disbursements through a drive-through, and then when they take the buses out, they're handing the food out from the one at a time, practicing the social distance. And they're also doing exercises through virtual, through Zoom also. So if you want to get your exercise in, you can follow them on Facebook or Zoom and get your exercise in.
Yeah. Zoom Zumba.
Yeah. But so they're having to be a little creative and come up with ways to still be able to deliver their services.
Of course.
Mm-hmm.
And I'm glad that they're able to do that.
Me too. Yes.
It would really further harm our vulnerable populations right now if they could not access those services.
Right.
I know that's always something that's heavy on our hearts and minds. Talking about our neighbors in need is, in a pandemic, we're having to shut the doors, but I also need to make sure that this family gets fed.
Right.
How are we able to do that? And they've been able to be creative and find different ways, going online or creating drive-thrus, and they're making it work.
Yes, they are. Yes, they are. And the schools are doing a great job feeding the kids too. So I think they fed 40,000, Athens City.
Over 40,000 meals.
So
yes,
they are doing a really good job as well.
They absolutely are. Thank you for that. So I'm a healthy person. I want to make sure that I'm doing my part to take care of my neighbors. How can I volunteer? How can I help?
Well, you can help. We have volunteer opportunities like packing grocery bags at Coordinated Charities. Kevin has masks and gloves, so only a few can come at a time to do that. If you want to answer the phones, take messages for him. Also, the Senior Center is to call seniors, to call and check on them, or just, if you have an elderly neighbor or family member that you can just check on, mow their yard, things like that.
That's a very good point right now. Grass is growing.
Yeah, and we also set something up on our website. If you want to show your appreciation for our healthcare workers at Star Regional, you can go on there, and under the COVID-19, there's a tab that says Send Thanks, and it's we send electronic thank you cards to Star Regional. So you go in and you have 3 cards to choose from. You can type your own message, and we get that sent electronically to Star Regional just to show our appreciation for what they're doing.
It seems like such a small, simple thing, but it really is uplifting when you get a little note like that. And especially when people add a little personal touch to it.
Yeah.
That's wonderful. So taking care of folks, not only immediate physical needs, but spiritual and emotional needs as well. That's really a whole person approach. I appreciate that. So do you have a special fund for the pandemic?
We do. We set up a recovery fund, a COVID-19 recovery fund, and a little promotion we did for Easter. We had we call it Community Easter Basket.
Yes.
And we figured since everybody was going to be at home for Easter, we asked that they donate what they would have spent on their Easter outfit, or taking their family out to a nice Easter lunch, or just their Easter goodies. And we have had an overwhelming response. I mean, we live in such a generous and caring community, and I just want to thank everybody who is supporting that.
Absolutely.
We've got almost $13,000 is what we've raised for that.
Wow.
And the Truist Foundation, which is formerly BB&T, gave a $2,500 donation, and the local Athens Kiwanians gave $5,000.
Yes.
And we really appreciate that.
Good. Go Kiwanians.
Yes.
All right. Is there any other special message or information you think is important to share with folks today?
I think if everybody just keep up the good work of, like Seth said, stay at home, don't get out, and except to go to the grocery store or whatever, just for necessities. Keep your hands washed, practice your social distancing, and just stay healthy, and help your neighbors. Check on your neighbors, and I think I know we'll all get through this together.
Absolutely. And that's the key, is us being together on the same page and helping each other out is how that we make it through this. Because there are brighter, fun days ahead.
There are.
We don't know how much longer we'll be through this necessarily, but it will be summer, and we'll be through this, and it's going to be a very happy time for everybody.
Yes.
All right. Thank you, Paige, for everything.
Thank you for having me.
Yeah, thank you for everything that you and the United Way all of the volunteers, all of the folks that donate, what you do to help our most vulnerable people in our population, and especially during this pandemic of finding ways to continue to serve. So thank you very much for that.
Thank you. Thanks for having me.
Tomorrow I will have Ms. Tina South on with the daily update, and she will be talking about another vulnerable population that we've talked about considerably the last couple of days, is our elderly and senior population. And those aren't necessarily the same thing, but we want to talk about McMinn County Senior Center and how they're working through this pandemic. And then Thursday I'll have Francis Witt McMahon to talk about the other side of the age range, our youth, and how CASA, court advocates, are being able to work through this pandemic, and really standing up, especially this month, as we're especially aware of child abuse. And so we'll have some good messages from them, I'm sure. I did want to tell you again that anybody, and this is the Tennessee Department of Health, they are pushing for anybody that wants to get tested for COVID-19. Tests are available. They're free of charge. It doesn't matter where you live. Doesn't matter any of those things, if you have insurance or not. If you want to be tested, they are testing at the McMinn County Health Department from 9 a.m. to noon all week, this week through Friday. And we will be hosting a 3-hour more widespread testing opportunity at Regional Park Conference Center on Saturday. And I'll give you more information about that as we continue to develop that with our Southeast Regional Tennessee Department of Health, and the National Guard is helping staff that operation. So we do want to make sure we have plenty of tests, and if you want to test, if you want to be tested, then please take advantage of this opportunity. And so that I'll give you more information with that as I continue to develop. I mentioned yesterday with Governor's Executive Order number 27, which extends the stay-at-home period, which today was going to be the last day initially. Now it's extended until April 30th. It also continues to close those non-essential businesses that were specifically listed in the governor's orders. Hair salons, spas, tattoo artists, businesses of that sort, massages, any of those personal touch type businesses that are specifically listed by the governor's order are closed through April 30th now. We talked about schools. That goes a little bit past. April 24th was the day that we had set previously that schools would be looking at whether they were going back or not. This order extends past that. What does that mean for schools? And we don't know yet, but the governor, I think, has announced he plans to address that tomorrow, and so perhaps tomorrow we're going to be able to share that information with you. So stay tuned, and we look forward to seeing you back on the Daily Update tomorrow, and I hope that God blesses you, and may God bless Athens.